At least 3 children have died and dozens of others have become ill from an unusual syndrome that could be linked to coronavirus. Now, doctors here in Indiana are urging parents to know the signs of the illness. CBS 4's Courtney Crown spoke with a local infectious disease doctor to find out more.
A new mystery syndrome seems to threaten children's health who have been exposed to or have had COVID-19.
We're still learning a lot about it, but in general, I don't think it's something that is something necessarily that we need to be panicking about, but being informed is also very important.
What's known as pediatric multisystem inflammatory syndrome acts similarly to other serious inflammatory conditions like Kawasaki disease and toxic shock syndrome.
Persistent fever, so fever for 4 or 5 or more days, is kind of a hallmark symptom of all those syndromes, of rash, of hand, foot, or swelling, redness of the eyes that we call conjunctivitis, abdominal pain. So a lot of the symptoms are the same because it's all inflammation of the body.
Is there any way to prevent it?
There's not any way that we know of to prevent it right now. We are still in the very early stages of figuring out who is susceptible to it, what, and why are some kids getting it. But we don't know exactly how to prevent it.
We checked with our local hospitals, and so far there aren't any cases in Indiana. Doctors advise patients not to panic at the first sight of symptoms, considering most of them are things that would not otherwise send parents rushing to the ER.
We want people to really be informed about what the symptoms are, and we want people to stay in communication with their doctor.
Dr. James Wood with Riley Children's Hospital claims PMIS doesn't appear to spread.
The inflammation syndrome is not contagious from person to person, but it is seemingly kids that have been exposed to it or had the disease that are getting it later on.
Courtney Crown, CBS 4 News.
The New York State Department of Health reports they are investigating 85 cases of this syndrome. It's mainly impacting school-aged children, but again, we don't have any cases here in central Indiana.